Ms. Barajas is having the same technical difficulties I have with my iPad. And I fortunately do have her statement. If the chair would be so kind, I would be happy to finish reading.
I would appreciate that, as we all would. Thank you.
I hope I pick it up at the right point. Yes, here we go. The disability community is adamant in getting lawmakers and Governor Brown to understand the importance of improving the Social Security income system, along with the state supplemental payment program. Recipients of these programs currently receive $8.89 per month, that's individuals, which is only 90% of the federal poverty level, certainly much less than what's needed to be self-sufficient. The lack of adequate income has left persons with disabilities unable to feed themselves, find affordable housing, unable to afford health care, and countless other areas that most people take for granted. Recipients of SSI have not had a cost of living adjustment in the last 6 years. In January 2009, recipients were receiving $907 a month, which was 105% of the federal poverty level for an individual. From then, there's been cuts to SSP grants and no cost of living adjustments. Had this not been true, recipients would find themselves at 106.7% of the federal poverty level, according to the California Budget Project. This equates to more than 1 million seniors and persons with disabilities living below the federal poverty level. In the past, the state of California sometimes contributed an annual cost of living adjustment on the total SSI-SSP amount. In 2009, state legislators revoked the SSP cost of living adjustment and cut the monthly state contributions to the SSI-SSP grant for individuals over time from $233 to the federal minimum of $156. Grants for couples were cut I think that's by $172 a month. The governor's proposal to spend $2.5 billion on the SSI-SSP grant equals $1.4 billion cut as compared to the fiscal year of 2007-8. This enormous cut will be felt by seniors and persons with disabilities who will be forced to choose between food, housing, and medical. The savings of over $1 billion comes at the cost of reducing a vital source of income for over 1 million people in California. There are 3 proposals to raise grant levels to bring all those on Social Security above the federal poverty level and eventually above the U.S. Census Bureau supplemental poverty measure. 2, to provide a cost of living adjustment for the state portion of the Social Security grant. And 3, to address hunger among Social Security recipients who are ineligible for federal food assistance, the SNAP program, in a way that does not harm or reduce the benefits of any Social Security recipient. Thank you, Kathleen Barajas. Thank you.
Ms. Barajas, you're getting quite a bit of applause out there. I want you to know that. Thank you very much for making the trip from Los Angeles. The committee did see a request based on the nature of today's agenda to attempt to have remote sites where folks wouldn't have to travel to Sacramento. And we tried diligently. And just as your iPad had technical difficulties, we here in the Capitol don't yet have the capacity to make that available to Californians who want to participate in this process. But we will continue to push to try to create that opportunity. But thank you very much for making the trip and participating. Any questions from either committee members? Okay, we will open it up to public comment. We've got a pretty lengthy queue there, so I'll remind everyone to please feel free to use ditto if someone made your exact point before you could get to the mic. And we're going to limit everyone to 2 minutes each, and I will give you a sign when you're about 10 seconds out. First witness, please.
Yeah, Kevin Aslian, Coalition California Welfare Rights Organizations. I can't do a ditto right now, but the COLA that we have today, that we don't have today was put in by Ronald Reagan in the early 70s. And he established a COLA for the most vulnerable people in our population, for seniors, aged, blind, and children. So we had the SSI COLA and the AFTC COLA. And in 2009, they repealed both the SSI COLA and the CalWorks COLA. So we would urge the committee not to dump the kids under the bus. And if you're going to restore the COLA for both SSI and CalWorks. Thank you very much.
Thank you. Next witness.
Good afternoon. Thank you for your time today. My name's Stuart Campo. I'm 58, and in January of this year, I became homeless for the first time in my life. Since then, I've been staying at the St. Mary's Senior Shelter in Oakland, and since I've been there, I've become more and more aware of the number of homeless seniors out on our streets. It's sad and disturbing that the elderly are being abandoned and having their benefits cut at every turn. Most other modern countries in the world respect and care for their seniors better than we do. It's becoming increasingly difficult for seniors to enjoy the quality of life they deserve and have earned. Please restore the cuts to SSI, SSP, and the cost of living adjustments so that we can have a better future. Thank you again for taking the time to hear our voice.
Thank you very much for coming. Next witness, please, 2 minutes.
Thank you. Thank you for your time today. My name is Fred Barnes. Historically, budget cuts have hit the people with the smallest voice and the least representation. The reality is that many people live below the poverty line. Hard choices must be made on a daily basis: shelter, medicine, or food. I urge you today to restore cuts to SSI/SSP, and I thank you for your time today.
Thank you so much for yours. Next witness, please, 2 minutes.
Yes, I'm glad to be here and hear how well informed you on this body are. I have to say, make a decision and have at it.
And could you just give us your name for the record?
Yes, my name is Harry Kenner. I'm from Oakland, California.
Thank you very much.
Thank you very much.
Appreciate you. Next witness, 2 minutes.
Deborah Doctor, Disability Rights California. Taking to heart what you said, Ms. Mitchell, when we started off, it should not be public policy of California to have people live in poverty. And that's what we have. And every day that we don't change that is, I think, a day of shame for this state. I want to say that one of the reasons that we support the restoration and further for SSI is that for the folks who live on SSI, it's what keeps them out of nursing homes. It's what keeps them in their own homes, which means that the state, is more or less complying with the Americans with Disabilities Act, which is 25 years old this year. And when we set up restrictions on their income or our policies that have the opposite effect, that drive people into institutions because they can't survive at home, or they stay in institutions because they know when they get out, there will not be a place they can afford to live, we are flying in the face of federal law. Also, I don't think the folks who are on SSI are like saving up that money. I think they're spending it in their communities. I'm pretty sure they are, and I'm pretty sure they don't get special grocery prices or gas prices. And if you look on Craigslist, there isn't any list of especially cheap housing for people on SSI.
That's right.
They live on an incredibly small amount of money, facing the same prices and much worse choices than many of us.
10 seconds.
I ask you to restore and do the right thing by them. Thank you.
Thank you very much for your testimony. Next witness.
My name is Judy Jackson. I live in Alameda County, in which renting a studio apartment costs 116% of poverty. I am fortunate in that I have Section 8 housing, so I have an apartment. But you asked earlier, what happens, how do they survive? They survive by going to the food bank the first thing every month. They survive by not buying new clothes. They survive by doing without medicine when the pharmacy says, your medicine is $63 a week. This is how people are surviving on the amount of money they're getting. I'm not a deadbeat. I taught school for 20 years. In between teaching school for 20 years, I ended up with breast cancer twice. You have to spend down all of your retirement in order to get Medicare so you can afford the operations for breast cancer. Then I went back to work, but I had to go to work in American Samoa because nobody in California would hire me, because when I had breast cancer, 4 out of 5 were dying. And they didn't want to hire anybody who was dying. After 6 years of teaching in American Samoa, I came back to the United States. And teachers have to go through a 3-year tenure period to get on permanently. Because at the end of that tenure period, I had bronchial asthma and couldn't do yard duty. They were sure I could teach because I'd been teaching for 3 years. But when you can't do yard duty, they're not going to hire you permanently. That's how I ended up on SSI. Thank you.
Thank you so much for coming today and sharing your story. Appreciate it. Next witness, please, 2 minutes.
Hello, my name is Doshea Maria Rabant, and I'm a homeless activist. I'm here to tear down, hoping you guys can tear down the wall of poverty for elderlies as myself and children. I'm a voice for the speaking of the ones who's not able to be here to speak for them. I also live on a budget of $889.40. I'm not able to live on my own because I don't make enough money. They want double the rent. And I've had a stroke within 5 years. I nursed for 28 years. I worked for 157 for 12 years. I carry 2 jobs to be homeless now because of the stress that I can't not perform. I walk like I do because the medical won't cover so many days in therapy or rehab. I'm here because if it wasn't for God, I wouldn't be standing here today. If it wasn't for the budget and the poverty that we have and the homeless people that lives in here, and these people here right now that I speak amongst, our budget doesn't carry $50 through the month after rent, after bills, and we can't even afford after our Medicare. I can barely see your names up there because I can afford the right pair of glasses for me to see. I was wearing 2 pair, but these are the best that I could afford because of the budget. Tear down the poverty, help the people that's elders and the children that's disabled. We need 100% that money back so we can stand and be proud of who we are because we are somebody.
Thank you very much.
Thank you very much.
Thank you, ma'am. Appreciate you. Next witness, 2 minutes, please.
Good afternoon. My name is Secret. Please don't tell nobody. And I just thought I'd throw in there. I want to say thank you so much for hearing us out. I am a member of the East Bay Housing Organization as well as an activist in my community at 1955 San Pablo Avenue, in Oakland, California for the senior citizen residential housing. I just look like this. I'm 60 years old. I'm also a member of EPO, which is East Bay Housing Organization, as well as EBOSSI. I am a 60-year-old Black American queen, and I'm also on SSI. They're taking out almost $100 a month out of my check, which is not cool at all, because then I'm thinking that I'll have to go and sell my body, which I'm too old for that, or sell drugs. I can't be on no corner trying to sell nobody. That's not going to help.
No, and it's illegal.
And it's
so
illegal,
do
too.
that.
And I done did that and done that. I don't want to do that. I'm not going to do that. And I'm asking you, please, because they're taking out because of overpayment. Let them take it out of their pocket and see how it feels. And then once they feel like that, then they can come holler at me. But I'm asking you, please, please, tear down the walls, the poverty walls for our kids, our senior citizens, and everybody in the community. And may God continue to bless each and every one of you. Happy Easter, and thank you.
Thank you very much for coming today. Appreciate you. Next witness, 2 minutes, please.
That's a hard act to follow. Hi, I'm Madeline Korn with Dogfight, which is a consumer advocacy agency here in Sacramento for the senior and disabled. I'd like to focus on the economy and the role that the poor people of California play. Common sense suggests that by increasing the SSI-SSP to the federal poverty level, returning the COLA or cost of living adjustment that was taken away from us, that the poorest of the poor in California will have the potential, if not the power, to drive local economies toward progress again. One reason I believe this is that poor people spend money, they cannot save it. They spend it on what I call the infrastructure of everyday life. They spend money on grocery stores, retail outlets, gasoline stations, medical services, car insurance, a car seat for a child, car registration, car repairs at a dealership, traffic tickets, schooling, and other resources that create opportunities to escape poverty, poor health, and criminal infraction. When local businesses see profits from increased customer buying, they will be able to hire more employees, to get bank loans for investing and opening new businesses. Business can sell more at retail instead of giving it away to the food banks because it has been on the shelf too long to be sold to the general public. The numbers of indigent poor has grown so great in California that our numbers cannot be ignored where the economic health of a community is concerned. Help us tear down the wall of poverty by increasing the SSI-SSP and giving us back the cost of living adjustment to sustain the progress we know we can make in the community. Thank you so much.
Thank you. You did a fine job following Secret. You did a fine job following her. Thank you. Next witness, please. You have 2 minutes.
Okay, thank you. I'm not going to get on you guys' back. Too bad. But my heart go out to Ms. Brown because my wife was in that position. And the caregivers, my heart go out to them also. But I just want a summer moment from the committee. If you just bow your heads or close your eyes, just think of someone that you really loved from the past or even the present or even in the future. I commend you for listening to everything everyone has to say. And I do believe that you work very hard and you're good at it. But just think, when I leave this podium, just think of one of your loved ones, the children, or even a caregiver that probably have to care for you one day, standing right here fighting for you. Thank you.
Can you give us your name for the record, please, sir?
Yes, ma'am. My name is Ronald Keels. I'm 56, and I'm with the St. Mary's Center.
Thank you very much. Appreciate it. Next witness, please.
Micah Doctoroff for the American Civil Liberties Union of California. I wanted to thank all of the brave men and women here sharing their experiences today, and I'm honored to be amongst them. Nobody living on SSI, SSP should be living in poverty. And the ACLU would strongly encourage the legislature to reverse the cuts and restore the statutory cost of living adjustment. Thank you.
Thank you. Finance? Finance? Oh. Would you do me a favor and just, the mic right there on the podium, would you just push it down? Just push the mic. Yes. Thank you very much. Thank you. Hello, my friend.
Okay. Rick Hodgkins, disability rights advocate, disability rights activist, and disability rights extremist. That is my stage name. This state has changed from the Golden State to more of a dictatorship since the Schwarzenegger administration. How dare the previous governor as well as the current governor expect SSI and SSP recipients to live in poverty and work for less than the minimum wage? Look at cable. Cable prices have gone up. And even though I get Section 8, I still have to pay the exact same prices for everything else except not only for my rent, but also for my utility bills because I'm on an energy assistance program. And also, sadly, food banks, you can only go to one food bank a month. You can't go like once a week, like you have to go to the grocery store at least once a week or every other week. And all I could say is I think you need to be wealthy before you can be healthy. But since this population cannot get wealthy anytime soon, Why don't we use the same price index that the federal government uses? And, let's have the rich pay up. Thank you.
Thank you. Next witness, please, 2 minutes.
Madam Chair, Senator, ladies and gentlemen. My name is Charles King. I'm 72. I am currently homeless. I'm a senior advocate for St. Mary's Center. And you know the numbers, you know the stories here, and none of them are pretty. I ask you to restore the SSP and the COLA because it's going to benefit the children, the disabled, and the seniors. Thank you.
Thank you very much.
Hello, my name is Russell Rawlings. I'm president of Dogfight, a disability organizing group for initiating total equality. We are a consumer-driven advocacy group for the disabled here in the Sacramento area. And I've found myself in this very chamber every year for the past at least 5 years, asking for the very same thing that we're asking for today. And, I'm going to say I am really... I've been touched by the testimony today. I think you're getting better testimony than you've gotten in at least 5, maybe plus years. So I would really encourage all of you to search your hearts and find a way to restore this COLA. I know that the governor is putting pressure on all of you to be tight with money, but unfortunately, the tighter you are with money, the harder it is for those of us that survive on this money to survive out here. There is no way that an individual can afford an average rent or even the below average income rent here in the Sacramento area. I can't even fathom what it would be like to live in the Bay Area. So I just encourage all of you to really push hard against the governor and get us this COLA back. Thank you.
Thank you very much. Appreciate it.
Good afternoon. I'm Sid Ipsy, member of California Alliance for Retired American, Senior Disability Action and California Partnership. Our organization support to serve and enhance the SSI and SSP for senior and disability action. We want to restore back the cutback. My mom was in SSI before, alive, and it's hard to live in San Francisco because of the high cost of living. We want, they need help, and they are human beings to exist. Tear down the barrier of poverty. We want poverty free now. Thank you.
Thank you very much. Next witness, 2 minutes.
It's good afternoon. My name is Joyce Calagos. I'm proud to say my first BA was in social welfare, and I had a multiple severely handicapped credential. So for 3 years, I was a special education teacher and teacher's aide for severely handicapped and learning handicapped. I also was a first lay promoter for justice, peace, and care creation. And right now, I'm with the Senior Disability Action in San Francisco, California Alliance for Retired Americans. And last week, I attended the Senate Assembly hearing for SSI, SSP. So again, we're asking to restore the SSP, SSI grant and the cost of living, and also to add food stamps to it. California is the last in the nation. They don't. We are the only state that doesn't add food stamps to the SSI. Also, Senator, you were wondering how people like me survive. Like for food, each week or every other week, I go to my church's food pantry for canned goods. I go to St. Anthony's Dining Room for the food. I go to the food pantry on Wednesdays for fresh groceries. And I don't have that enough money, so like when I got sick with a cough, people at church got after me. So I spent $98, which I couldn't afford, $25 to visit the doctor, $39.80 for antibiotics and for the codeine cough medicine, and another $35 for the lab test. I can't really afford that. So when I ran short, I have to ask my co-worker, fellow parishioners, can you give me some money? Not even loan. Give me, because I can't afford to pay them back. So please, tell us, Governor Brown, he's a Jesuit seminarian, Pope Francis is Jesuit. So please have mercy and compassion on us poor SSI folks. And Jewish Christian tradition is everyone is created in the image and likeness of God, and we're to be treated with worth and dignity. So please give us the cost of living and restore the SSI, SSP. Give us the food stamps and let us live in dignity.
Thank you very much. Next
Hi,
witness.
My name is Ligia Montano, and I'm with California for SSI and Senior and Disability Action. Like my members here, you know, I came here thinking, wow, these people, they don't really understand. But I think you guys get it. It's really hard for people that are on SSI to survive. And it's really hard to think that many of us, even though we work so hard, we're gonna end up maybe getting SSI. And you know why? Because the minimum wage is still really low. So my mom was always working minimum wage jobs. And her Social Security retirement is only $400 and something. So she needs to get SSI to complement that. And it's not enough. It's not enough. And those choices that Joyce was talking about, they're real. It's either pay the rent, pay the food, or medicine. And thanks God, we did a lot of work in San Francisco, and we got free muni for senior and people with disabilities. But it's still a lot of things that we cannot provide for them. So please, please, find your heart, or maybe better find the governor's heart, if he has one, you know, so he can really restore that, you know, the SSI, SSP. Thank you.